Hey guys, Dr. Alstall here, back again, for those who don't know me, with another video. And so for today's topic, I just want to talk about how insignificant your money is to your wealth. Well, I wish that was the case. In reality, in the real world, a person's wealth and social class are heavily tied with their health. I think I'm just moving a bit too fast. Let me explain some of the more simpler concepts to you. Let's talk about wealth. Wealth means or refers to the value of everything a person or family owns. It can be money, land, stocks, bonds, anything. Anything that has monetary value. Oh, all right. And social class. What is that? Social class refers to the large number of people who rank close to each other in terms of wealth, power, prestige. It can either be resources as well, such as like job and education and lifestyle. In this video, we will specifically be discussing social class in terms of wealth and income. For those who don't know what income is the amount of money people actually receive. So, if you work as a doctor, the salary, that's their income. In order to understand how a piece of paper can impact one's health, I'll replace it with starburst. The more starburst, the more the the more starburst a person has, the richer he or she is. In this case, I have all this. It's not a law, but it will, get the point through. So with the first one, let's say he has one starburst. For the second person, he has 5 starbursts, which is, that's 5. And for the last one, the richest one, I can replace it with this entire box, but just for the sake of transparency and congruence, we'll do that. In reality, the poor person probably has 1 starburst, and the richest person on earth has like 1,000 times more than that. So, anyways, there's one rule of thumb that you have to know when it comes to inequalities, especially when it comes to wealth and the health system. So the wealthier you get, the healthier you become. Anyways, let's get right on with it. So the first scenario follows 2 people. One has 10 starbursts, as we said, and the other has 1. The one in the middle is going to be like the one in between, He has the moderate. Let's say that he's control. On Saturday morning, both of them simultaneously experience fever. Who is more likely to go to the hospital and why? Pause the video if you want to think about it real quick. Obviously, if it turns out that the starburst owner is more likely to go to the hospital. According to a Sage journal published in 2017, the majority of respondents thought their access to healthcare was bad as a result of their socioeconomic status. I'm going to say SES because that is way easier. They either delayed or ignored pursuing due to the cost, which will further worsen their condition, and in return result in a pricier hospital visit. More so, a lack of physician and hospital in a low SES regions create a distance and time obstacles, discouraging them from going to one. So, if he's experiencing a fever or whatever, then it'll be like, oh, you know what? It's nothing. It's probably nothing. Then their health becomes worse. They have to go to the hospital as an emergency, and in the end, they'll have to pay a higher price. Let's continue and assume both of them arrived at the hospital, at the same hospital at the same time. Will there be a significant difference in waiting time for each? Surprisingly, according to a June 2017 article published by Science Direct, waiting times in the United States are low, regardless of socioeconomic status. So whether you are the CEO, the manager, or an employed person, your waiting time will all be the same, which is great. All right, so let's just go back a bit and go back to the original scenario. So instead of one experiencing a fever, let's say they're experiencing a heart attack this time, and they require immediate medical attention. Which individual is more prone to calling an ambulance, and why do you think so? I'll let you pause again and think about it. According to Health Affairs, a research article published in July 2013, the lower the socioeconomic status of a patient, then the lower the probability of using both ambulatory and primary care. More so, low SES patients perceive hospital care as more affordable, more accessible, more trustworthy, and of better quality than ambulatory care. In other words, if they feel sick or pain, then it is likelier that they will visit a hospital than call an ambulance. Continuing with the scenario, both patients arrive to the same hospital. It turns out they both have the same type of disease. Do you believe that the physician will treat them both the same way? As stated by the previously mentioned Sage Journal, most subjects believed that their socioeconomic status had an impact on the treatment. They assumed they had less available diagnostic tests, and with those are offered, they took a long time to be approved, thus slowing diagnosis and treatment. So, for the person with one starburst, they believe that they don't have a lot of, due to their insurance, they don't have a lot of available diagnostic tests, and with in addition to less availability, they have to wait longer to know what their diagnosis is, which can worsen the condition with time. So those are just a few scenarios to expose the underlying issues that are going on with the American health system and with the health wealth inequalities in it. And I hope that I taught you guys a bit and exposed you to some scenarios as to how the real world actually and unfortunate works. Of course, we are trying to prove our best into providing the equal treatment and fairness to all patients, regardless of who they are and like what their wealth is, what their race, gender, whatever, etc. We don't discriminate. Dr. Aliston with you again. Have a nice day.